Ayesha, this is exactly what happened to me. And reading these words, just took me back in time to where we started and where we are now. So thank you, Dr. Kadri. Um, uh, Aisha, as I was going through the book and you also, so I thought that we should ask, I have these questions and so do you, that only Dr. Kadri can answer. So if you allow me, I would like to start putting the first question.
You're in the line of fire, Dr. Q.
In the line of fire, sir.
Is this a PhD defense or what? I mean, I didn't realize that.
Yeah. So, Dr. Q, what was the motivation and drive to take on this project, Discover the Ibne Sina within, as this is a unique perspective for a young and fresh entrant of medical school? Dr. Q, your thoughts?
Again, I mean, I think this first question is a tough one because I would be lying if I said that I was always impressed with Ibne Sina. I think it was more a process of looking at several role models, a lot of whom have joined us here today in this very August, gathering that you have here online. And some of these role models and others who that you mentioned earlier on, like Aminsa, Maroom, and others, that who have been influential, and other cohorts, sharing experiences in the past, led me to think that perhaps one needs to, as our dean used to say, go back in time to move forward. And just a journey of looking back in time while incidentally basically serving as a regional coordinator for the NIH Introduction to Principles and Practice of Clinical Research courses that we started in 2014. And also with my experience with Harvard earlier on, one could see that the contributions of Ibne Sina within clinical research, and then when one would delve into that, one realized that this polymath obviously is very relevant to current times because of the way knowledge is doubling up so rapidly in our times, and because of the rapid generation of evidence and its application and needs, and global health problems and inequities. I thought one needs to actually look at the life of Ibne Sina and try and stimulate our young graduates or young students or entrants into medical school to actually try and imbibe his philosophy of wanting to know everything about everything and being good at that, including being a outstanding physician, philosopher, scholar, physicist, and the like. So I thought the relevance comes in primarily from the fact that in a fragmented healthcare system, and where medicine is more or less broken over the last 20, 30 years, with a lot of emphasis on the humanities not being there and just being science, and with the Flexitarian era all ushering in the science revolution, that we needed the humanism back in medicine, and none better than Ibne Sina to actually look at and try and see if we could revisit some of the aspects that he taught us. And I'm not advocating that we look at the Qanun in particular, because that was all about humors that he described, and a lot of things have changed, and medicine has progressed several fold, and a lot of other giants subsequently disproved a few things. But it's just the very fact that trying to put in the philosophical outlook and the critical thinking, I think it's important for our young graduates and current students all over the world to imbibe that holistic human being that he was, and within themselves, and try and see if one could reproduce something of that at the end of a career in the outcome-based education tradition. Thank you.
Thank you. Thank you for this answer. Ayesha?
Dr. Kadri, that really, sort of gives us an insight of why Sina inspired you. And especially when we talk about integration and contextualizing and third generation curriculum and process versus product, I think your inspiration is most appropriate, especially in these times. If I can ask you another question, we may be addressing the questions to you, but if you feel that you would like anybody else to add on to your responses, then you're most welcome, Dr. Kadri.
Yeah, all of them.
In your book, you talk about the importance of traditional education on subjects like physics, chemistry, math. But interestingly, and very rightly so, you've also linked life skill qualities like empathy, human behavior, uncertainties in life, failures, and the need to draw inspirations from poetic exhortations of Iqbal or the humor of Petrus Bukhari or with the poetry of Milton and Keats. So would you like to, sort of elaborate on how you think these add a dimension of expression of thought and emotions and can help our young professionals, to entrench with the current times?
Yes, again, if I reflect on it, I'm not sure exactly why those thoughts came in, because when you write, it's usually, I think most of us who've gone through this exercise realize it's an inspiration. And within that inspiration, one realized that, some of my mentors, including Professor Guyatt out here, he came entirely from an arts background. And from what I understand, I think it probably was maybe high school physics, chemistry, maths, Gordon. But beyond that, it was an arts background, and that's where a lot of I guess the social aspects of medicine were missing. And that's where I would think that a lot of those things, whether it is philosophy or it is music or is it poetry or is it humor, that all those things need to be put together to deal with the uncertainties of modern medicine, and because it's an uncertain art and science that we are dealing with. And I think a lot of us, I think Amin Saab used to say that medicine is a science-based art, or an art-based science, and if you will. So I would think that most of those things that I wrote at that time were inspired from the fact that a lot of our mentors came in from an arts background. And Amin Saab, despite also being heavily invested in science, but I think philosophy drove him as well. And that was the reason when I look back into Ibne Sina's life, as well as the lives of course, Iqbal as a philosopher and a scholar and a thinker, and as well as a lawyer. I think he brought in the same dimensions. Similarly, Keats and Milton had the same thoughts, through their odes or through the Milton's, Paradise Lost and Paradise Regained, written while he was blind. So all these things, one would think when one goes back, and if some of those things are put together in foundation modules, for instance, I think to try and build empathy, these would be important components, because science and the Flexnerian area, I think, made it very, very heavily dependent on science and pathophysiology, whereas the modern giants, such as those who are with us today, have always emphasized what works and what does not work, and is the evidence for it. And I think that is where the shift comes in, that medicine is not necessarily needs to be practiced with a science-based background, but a lot of it has to do with empathy and a hearts-based background, I would say. And I think that's why I must have written those things. But I hope that answers that. Thank you.
It does.
Mustafa, great points. And I am utterly flattered that you actually remember my own educational background. And only a slight correction, not even any high school courses, never took a biology course, even in high school. So just goes to show I think just reinforces your point as to these other core aspects of medicine. Very impressive.
Thank you. Thank you so much.
Thank you, Gordon. Thank you. So, Dr. Q, while introducing the foundation years of med school in the book, you talk about Mute's principle, Canadian CADMED's competency framework for medical graduates. And then you write, and I quote, "There is no reason that followers of Ibne Sina's legacy cannot acquire these skills." Do you think our students understand this legacy of Ibne Sina? And have we done enough to make Ibne Sina a professional idol for him?
The reason I said that was that I personally feel that our students have only been introduced to Ibn Sina as Ibne Sina earlier on in school texts, and I remember one fascinating story that used to be quoted, and we used to just accept it. I'm not sure what evidence supports it, but it's kind of interesting that when he was 13 years old, or 14 or 16, whatever, like a Doogie Howser kind of a doctor, he actually, somebody came in with intractable low back pain to him, and after a lot of physicians in the area could not actually find a cure for this ailment, he had this patient sit on the back of a cow and or buffalo, and kept feeding that buffalo or cow lots and lots of water. And as the legend goes, as the story goes, the buffaloes, the back and the abdomen and everything started expanding, and with that, since the person was sitting across the back stretched and the back pain was relieved. So, I mean, obviously, if you want to critique that, we can find lots of problems with this particular theory and narrative. But these are the kind of things that were emphasized, rather than his contribution to clinical trials and his contribution to actually the scientific principles of drug development, which I think a lot of us have imbibed since then, and his, of course, all the other aspects that he brought into medicine. So I thought that aspect is missing. That's why a little bit of an introduction, rather than writing another comprehensive treatise on Ibn Sina, which I'm in no position to do, and I'm not a scholar to do that. But I think if the students actually can get some inspiration and then look up his life, that would be important. That's why I thought something to bring them to that, introduce them that this is also something of a legacy that one had, and one could actually revisit that particular life. So I think it's not that students may be totally unfamiliar, but the relevant aspects, I think, need to be delved in, and that's why I think this probably can be introduced into some of the earlier years and in foundation modules and the longitudinal strips that follow. That's my thinking. I don't think our students are very familiar with our even current day heroes and in medicine or other, so they obviously know all the other data that comes in through the internet, and pick up a lot of things. But some of these things require an in-depth study going back in time. I think that's where the gap is, and I think, and I'm hoping that this book would inspire a few to actually look back in time and see where they can get further inspiration for developing these skill sets. Thank you.
Yeah, and
So
that is
true,
why.
Dr. Kadri.
uh,
Sorry,
Sorry.
so true. All that you said, such amazing legacies of the past, and the current generation, and maybe a lot of us don't know about all of them. So it's very relevant, and we really hope, and we are very hopeful that this book will serve to at least make a dent in whatever people think. When we move on, as we go along your the chapters, when we read the chapter on bridging the years, here you write about a burning desire to inculcate altruistic characteristics, especially in a fourth year med student, wherein you write that to me, generating ilman nafian, and to explain this over here, beneficial knowledge is real knowledge. Is real knowledge translation. Would you like to elaborate what you understand, or what you want to present as beneficial knowledge, especially in the context of Sina?
Yes, so when we look at again, in the presence of all these giants sitting out here, it will be difficult to do justice to this, but you know majority of evidence that is produced is not used in clinical practice, as we all understand. So a lot of research evidence, maybe only about 20%, 15% gets used in practice. So that means does not really get translated. And when we talk about aspects of translational science, when we look at clinical drug development, if we go all the way back from a molecule and its journey and through all the cycles and cell culture
For
mathematics, then we, subsequently, by the time we have generated evidence in the clinical side, a lot of those early phase studies and all are aborted because of methodological issues, and so don't really end up getting translated, even though the basic science and cell culture and perhaps animal studies may have shown some good effects, but because of methodological issues in early phase studies, perhaps things don't get translated. So what I'm alluding to is that unless knowledge actually changes population health, unless knowledge changes outcomes in terms of healthcare disparities and inequities, and it actually improves standards of living, and it actually improves your morbidity and mortality data, all that evidence, unfortunately, a lot of it gets filtered down, and if you really want to translate that into something that helps that helps heal the ailing, I think that's what translational science is. So what I would hope is that at the level where the students are at the junction of the so-called basic clinical divide, which obviously we all know in the integrated curriculum is very blurred. However, when they heavily get exposed to the clinical world in Pakistan, like in from late second year, third year, fourth year, final year, so then while looking at pathophysiology, while looking at disease mechanisms, while looking at the introduction to medicine and all the clinical methods, one needs to emphasize that unless all that knowledge is actually translated with multi-source, building blocks coming in from arts and sciences and humanities and biology and social aspects and living in tune with your society, it's really useless knowledge. So it is, and a lot of people say that there is some benefit of useless knowledge also. Creation of useless knowledge may be beneficial too, but in the context of resource-constrained societies like ours, I think we need to strive to actually change the outcome of people out on the street. And that's what I want them to try and understand at that stage.
Makes a lot of sense, Dr. Q. But I want to understand, when you say the world that we see, hear, or feel is only limited by the boundaries of our own reflections and understanding, are you urging young professionals to find within oneself a philosopher, physician, physicist, mathematician, astronomer, theologian, mystic, geologist, poet, musician, researcher, psychologist, political figure, author of Qanun? Do you mean to say that Ibne Sina is present in everyone, just waiting to be awakened, Dr. Q?
So again, another difficult question, but a lovely one, and I guess I have to respond to this. But let me bring myself now into the picture. I don't want to talk about myself, but I really think in this particular context I need to. So a lot of you who may have seen certain aspects of my life at work and others probably don't realize that a lot of my knowledge and secondhand knowledge comes in from somebody who shares my life, my wife. And a lot of what she says and a lot of what she reads and summarizes, I just tell her, don't worry, just tell me what the gist is and don't expect me to read all this. So what happens is that when you have second-hand knowledge and when you don't have in-depth overview of a lot of things, so those constructivist theory-related building blocks, they can't really reflect beyond a certain framework that you have fitted that in. So if you actually enrich yourself with the arts and humanities and literature and poetry and philosophy, then as a physician, perhaps when the arts and humanities come in, then you're able to reflect and you're able to expand your horizon in terms of the vision that you can actually put up for yourself much better. So I'm not sure if I could explain this, if I was able to explain this well, but all I'm saying is that if we have those faculties and if we've built up those faculties, our reflections will have no boundaries. So it's basically self-actualization in a lot of ways, yes, and but for one to actually go towards self-actualization, one needs to be a dreamer, and you can only dream if you actually have those components well established and you're able to go back and forth and apply them in real life problems, whether it is of a social nature, environmental nature, political nature, or simply from a medical point of view. So when I write this, I basically say that it actually reflects my own limitations. So I wanted to express this in some way that yes, I mean, like you can only build up those reflections if you actually have built yourself up, and that's where rising above oneself is what I advocate, and one needs to do that, and everybody has to do that. I think second-hand thing won't keep us in good stead in several situations. Thank you.
Thank you very much. Thank you very much. But we need to find ways uh, to to inculcate this thing in our students also, and this really is very motivating and very insightful for me. Thank you very much. I think we are
and that is
lacking over there.
And that's how you've built your case for self-actualization. I found it very well worded, wherein in your career choices you talk about self-actualization. So the journey you took the student from first year, this is the part that I really liked, how you carried them, or how you took them along in the journey from first year, built them, talked about competencies which are non-academic, helped make them a multifaceted individual, linked it all to who Ibne Sina was, and then you took them to the level of self-actualization. That is the stage where that you should be aiming for. So it's very thought-provoking, and you've written, if I can quote, you say, ask yourself these questions and begin your journey towards uncovering your Ibne Sina in earnest. So you've almost answered this question, but could you elaborate a little what you mean by self-actualization in the context of being a medical professional? Is it realistic, or is it just an illusion?
Yeah, I mean, it's like one of those things that you always seek as an illusion. It is like a utopia, as an ideal, but that is how one needs to, I believe, benchmark oneself to be able to find that particular level of khudi, or find that particular level of achievement where you actually realize that, okay, whatever talents I was born with have now been used and have now been employed in changing the state of people around us, particularly in the medical profession. One of the things I've noticed about myself is that earlier on it was all pathophysiology, loving, every moment of hyponatremia and all that biz. And these days, when I've slowed down a bit, I'm seeing patients in clinic, maybe 3 or 4 a day, no more, 6 days a week. But when I see them, I simply enjoy talking to them. I enjoy finding their backgrounds. I enjoy educating them. I enjoy trying to, find reasons for making them feel better. And I think that is the eventual aim of every physician, that you want to be a healer. You don't want to just treat. You want to heal. And for one to do that, then I think if one keeps building up that particular skill sets or competencies or attitudes within oneself, eventually when you start practicing that, you start feeling that maybe this is what it was all about. And then of course it becomes a bit late in life, but then you want to then offload that particular feeling to the newer generation of healers. So I think everybody, all of us have that particular ability, and it is it's really a purpose of life. I would say one needs to bring in that philosophical outlook, that yes, what have we contributed to the state of humanity around us, and the like, and a lot of those things are utopian. Obviously, nobody
Yes.
is saying that everybody will achieve that, but I think all of us need to do that within the field and all other fields around us to contribute to making a better society and world around us. Yeah, thank you.
Thank you, Dr. Kadri. These were the questions or the comments that came to our mind. I'm sure whoever reads your book will find so many things that they would like to comment on, so many things that they would agree with, so many things that they would like to deliberate on. But we can declare that you have successfully defended your thesis.
Yes.
I'm telling you, I've been challenged to my core, and I think the recording will tell us that, like any other fresh, a fresh a thesis applicant who's trying to defend his thing, a lot of it is just kind of, I've just used flowery language to cover my deficiencies. But that's what I am. It's not about me. The whole story is about Ibne Sina and Iqbal and all the huge mentors that we have within us out here. And I hope you will we'll have a chance over the next 10-15 minutes to listen to most of them, if not all. And maybe Dr. Rehma, can you stop sharing the screen and we can have a gallery view or another larger view? Thank you so much. Let me see if I can put you all on a immersive view, and if it works, just a sec. Okay, I think this helps us see a lot of people. I'm delighted to say that my sister is also here, and she's been an early mentor and friend for life, and had a big influence on whatever I am today. And I'm delighted to see her as well. And a lot of you, I thank you personally. And I think, go ahead, Dr. Ayesha and Rukhsana, if you have someone to, who wants to make any comments, please. Thank you.
Rehma, if you would like to moderate any questions from any of our participants, the floor is.
Yes, thank you so very much for that delightful session, Dr. Kadri, with Dr. Ayesha and Dr. Rukhsana. So we have Sir Aslam, and sir, please, the floor is open. You can have your question.
Oh, thank you very much. It's nostalgic to see you all. Right.
So the pleasure is all ours.
Dr. Kadri, my question is a bit speculative. If you have to write down multiple other books in the same area, like discover Al-Razi within, or discover Qasim within, or discover Al-Tibri within, or to discover Al-Nafis within, will the contextual approach would differ from as compared to Ibne Sina within?
Yeah, I think, again, a remarkable question. I would say that a lot of these sages shared similar thoughts and philosophies. Razi, of course, is very, very popular in the East, whereas Ibne Sina is probably a little more popular in the West. And unfortunately, Ibne Sina or Avicenna was shunned in several parts for questioning a few things and for his rational approach. And that is what I wanted to really look at, because I felt that people had done injustice to him in their writings regarding his role, just because he challenged the common thought, he challenged dogmatism, he promoted rationalism, and he questioned things. And yet, this gentleman was also somebody who had memorized the Quran by heart. And you don't do that if you don't have a passion for that. So yet people looked at him. And so I thought that it would be very relevant for the current context worldwide to revisit him. We have a statue out at Harvard Medical School as Avicenna, and I think everybody respects him, his work. Imagine writing a textbook which was almost contemporary. Maybe medicine obviously wasn't rapidly developing, but for 5 centuries. So I would say that things would be a little different. I personally would say that out of all these people, I'm inspired the most by Ibne Sina, Avicenna, and I think we need, especially in times of intolerance, especially in our societies and worldwide, I think it's time for us to embrace figures who we've shunned because they had different points of view. And I certainly think that for me, he was a role model. But Razi also had a lot of remarkable contributions, Al-Razis. But I don't think I'd be able to do any justice to any of these, including Avicenna. I've just kind of pointed a few things out in outline. But yes, I think the approach for anybody else who wants to look at them as role models would be there. We have current day giants as well, and I think people all are impressed by somebody. But something triggered within me a need to go and revisit Avicenna's history. That's why that's where I got my inspiration from. Thank you, sir. Thank you for your comment.
Thank you very much. Thank you.
Thank you, Sir Aslam. And if we have any other question or a comment from the participants, Dr. Zafar Zaidi, please go ahead, sir.
Right. Thank you very much. An excellent presentation. I've known Mustafa much longer than probably most people here. Because we've been together since high school. My question is more of a comment than a question. I mean, we all agree that the empathy and the humanism is certainly very absent from the medical education, and we are all trying to bring it in. And it's very useful, and I think excellent to introduce in an icon like Ibne Sina. And as Aslam Saab said, other icons are there as well, can be introduced. I suppose we are not exposed to all of these people, and they are not in our common knowledge. That's why we don't know how good and what they've been doing. My comment and probably question is that with the ever increasing amount of knowledge that has to be imparted in the medical education, it's difficult for a person who's in the early 20s to be sort of focused on the reflective elements of things that all of us here sitting are we've crossed that barrier years and years ago. So it is easier for us to reflect back on things, to look at various things and from our own experiences and from others, and then to build it in. So I think the real challenge would be for somebody who's constantly exposed to technology, to the high-tech things, to actually bring them in focus on humanism as an important element. And I think I would only say that it's like role models like Dr. Qadri who can actually do it for them, where they can actually not only just learn it but also see it happen. So it's a remarkable achievement. I think you've done very well to trying to do that. And for youngsters to read this book who wouldn't be thinking in this way, it may be enough excitement for them to actually take it on further.
Thank you. And you had a question as well, Zafar. I'm sorry if I missed it.
No. It was more of a comment than a question.
Appreciate it.
Thank you, Dr. Zafar. And I think the question that was first asked by Dr. Rukhsana regarding giving a unique perspective through this book to a medical student who is just 18 years of age is really it's really a remarkable achievement. And it's I think it's an out-of-box concept. We have Gordon Guyatt. Go ahead, please.
So
you
thanks
have a
very
question.
much. Mujtaba, are you aware of Victor Montori's book, Why We Revolt?
I know Victor Montori, but I have not read the book. Yeah.
Okay. So the book is very, in terms of your fundamental theme of how medicine should be practiced and what we should pay attention to, Victor describes the way he puts it as delivering careful and kind care. And in the Why We Revolt, which I would suggest for everyone, it sounds, and in the comments, you focused on technology and education that does not put a sufficiently high priority on, to use Victor's term, careful and kind care. Victor also taking what may be a uniquely American perspective, blames what he calls the industrialization of medical care. with a focus on finances and profit, and that industrialization is fundamental in moving us away from the sort of humanized care that you are advocating. Does that resonate at all with you, or is that something that may be unique? Victor describes it in a very compelling way to me anyway, within American medicine. Is that industrialization of care part of the problem?
Certainly, Gordon. I think if you guys look at the epilogue of my book, where I talk about uh, why medicine is broken or fragmentation of healthcare, I think industrialization of care or commercialization of care or capitalization of care, whatever you want to call it, I think certainly that is an aspect that has taken away a lot of spirit in my mind from the patient and the healer. And we now become a customer, and those are the terms that are now used in healthcare quality metrics as well. So, you're talking about a customer, you're talking about internal customer and external customers and things like that. And I think that aspect of trying to bring back the healer, the healer's voice, the healer's touch, the healer's empathy, the healer's compassion, and the healer's communication skills or advocacy in society, I think that requires a complete rethink. And Victor Monterey's work, I remember meeting him at your first EBM one in New Delhi, and spending and looking at some of his work at that time. I know he was presenting something more like health education cards related evidence that he had created and how it impacts patients' behavior in terms of adherence, so to speak. But I know that this is exactly what has resonated within us in Pakistan as well, where we feel that a lot of our care is fragmented and broken. And I think a lot of rethink at the earlier level is required, because by the time we try to fix it, most of us are, downhill, and then one needs to go really early at students and in order to try and have them understand that it's a lifelong learning business. It's not about putting everything within your 5-year curriculum and curricular overload, but one needs to just stimulate and excite and light a candle, and then show them that this is a lifelong journey of love and empathy and care that they're embarking on. And if they don't have those features within them, well, one can probably develop them through some of these other arts and humanities inputs. But yeah, I mean, I think Victor's work, what you are alluding to now, I think I should be reading that book. Certainly, I feel that would be important. I think Mubin is raising his hand, Professor Mubin.
Dr. Mubin, if you have a question, please go ahead.
I don't have a question, but as I was going through the book, and Dr. Qadri, I was just trying to reflect. Maybe that is what is or was in your mind, and that's what I think, that probably Sina is more of a metaphor. And yes, one can take Nafis, one can take Khwarizmi, one can take any other a Muslim scholar or a polymath, or the similar applies to the West as well. We know that there are wonderful people who have done or wonderful mentors or wonderful people with integrated way of practice. So I see Sina more of a metaphor for those 7 things that you mentioned in your book, CanMeds, I guess. And those are the ingredients, and I think those ingredients can vary in different people. I would doubt that anyone would claim that all those ingredients are equally balanced and equally manifest in our behaviors or practices and all that stuff. But at the same time, it is just the achievement or the journey towards excellence, that has to continue. And one of the themes that I thought or I derived from all this was that, using that metaphor really helps us to make sure that our thinking evolves, our reflection evolves. And that's what I think prevents us from getting dogmatic in terms of our thinking. So I think that's wonderfully done in your book. And on lighter note, I remember about 22 years ago, maybe 21 years, when first time I met Dr. Qadri, and that was in one of the morning reports. And at that time, they were discussing a blood gas. And, I being a critical care person was, I also jumped into that discussion and whatever happened. And interestingly, if you maybe see us maybe on any of the Tuesdays or Thursdays, we still do the same. We both are discussing, the same blood gas, and he is using his dialysis machine and I'm using my ventilator, trying to fix that chemistry, which has gone wrong, and trying to, and thinking that hopefully that will fix the biochemical processes and eventually at least heal the body and eventually the mind, and the practice of professionalism and showing empathy and eventually getting the patient back to his feet and moving on. So I think really wonderful. This piece is important, but at the same time, I also think, and maybe something that you can probably think in some way, that these strands that you want them to have at a stage when they are 18-year-old should start pretty early, and unless they start early, and then it is much easier for us or educators to build once they are in that 5-year period. And then not only that, but also maybe when they have graduated and they are in their real life practice. That is what matters. So what I see when you say fragmented healthcare, I also see fragmented education. And that one fragment is the one which is pre-medical or I should not say pre-medical, pre-professional. That could be, engineering or any other profession. And then there is a professional life of education, and there is postgraduate education. So there are things that we need to align. And I think we have to be pragmatic. We have to be realistic in terms of, making the change, because whenever you mentioned 4 patients, remember that there'll be pressure of seeing maybe 20 or 30 or 40 patients in a day as well. So all these things eventually have to be mixed in such a fashion that whatever we do, that should not stop our thinking. That should make the reflection or empathy or those things can be minimized, but they should not disappear. So I think that kind of an approach, will be helpful, and I'm sure that you and all these people who are kind of working in this particular area can see how can these things can be aligned. Thank you so much.
Thank you. Really appreciate the comments.
Thank you, Dr. Mubin. Do we have any?
I think
we have a comment from Dr. Noman Tarif. Initially, he said it's very rightly the empathy and human touch is missing from our training. Our students start at a relatively immature age, and responsibility on us increases to inculcate these properties. Very rightly said. Dr. Qadri, would you like to comment on Dr. Noman Tarif?
No, I think Professor Tarif again is a leading nephrologist in the country, and we share some years going back in Riyadh at times as well. And he's also obviously with Fatima Memorial, other areas he's worked with, he's dealt with undergraduates and graduates, and we realized that our students come in as 18-year-olds and not 22-year-old entrants. as after a 4 years baccalaureate. So most of our students are coming in at 18, and obviously a lot of these aspects need to be built in. But I believe that I would again allude to our dean, late Dean Amin, who used to say that, for God's sake, don't treat them like kids. They are adults, he would say. And that is the thing that if we think that 18-year-olds are, not capable of imbibing these things when they come in, yes, they have different life experiences. And obviously, somebody who's got 4 years more has been shaped up by other experiences. But it's just that a lot of these things, I think, when we talk about inculcating them, yes, perhaps one can work harder in the earlier years to try and demonstrate that we're not here just to pile up tons and tons of knowledge and develop perfect scores here while you're in those 5 years, but it's all, we want to develop a portfolio or of attitudes and community service and advocacy. Those are the kind of things, and for that to happen, earlier exposure to patients, I think, would help in building that empathy. If we keep them away from the clinics for the first 2 years, then again, what we are doing is delaying that particular maturity. And that's why the integrated philosophy, I think, is so important, to have that early exposure to patients, shadowing everybody in the clinics, perhaps from day one, and having regular exposure, so that they see that this is what they're seeking out to do, not the anatomical origin, insertion, and and action potentials and all those other kind of things which are there. But this is the crux of it. This is what we are trying to achieve. So I think the early exposure should help even at 18 and other ages. I think a lot of us who got influenced into going into medicine, some of us in Pakistan, by the way, Gordon, we get influenced because our parents tell us to go into something. And that happens because, there's, at least in our era, there was nothing else besides medicine and engineering. But now, with all the other professions, like my second son says, anything but medicine. So, that is fantastic to hear, in this particular era. So I hope that answers that particular question of Dr. Nauman. But I think we all are aware that we need to be able to provide some experiences which will help develop empathy. Thank you.
If I can just add a comment over here, we are talking about these students being immature and all. I do agree that I do agree to it to some extent, but on the other hand, I feel that we do interact with millennials and this generation. I find them somehow better people. They are less judgmental, they are more empathetic, they are more tolerant to diversity. So I do feel that they are reflective. They may not know about the legends and their legacies, but somehow I feel that it will not be difficult to sort of channelize them.
Right. Can you comment?
If I may just ask one of our students here, I think it is Manahil from Karachi Medical and Dental College, year 3. She is online, and maybe you can hear a minute of her reflections on what we've been talking about. It will be fantastic to hear from you, Manahil. If you don't mind, can you say a few words about whether you think bringing in Ibne Sina and the arts earlier and early patient exposure, what has your experience been, and what do you think about what has been discussed so far? Manahil, can you unmute yourself? Or you prefer to? I'm not sure if I managed to get to Manahil. That's fine. Then please go ahead. Go ahead. Maybe Manahil would like to say something. I'm not sure. Okay.
Well, can you comment, Dr. Qadri, on what Dr. Ayesha Rauf has said?
Go ahead, Dr.
Yes, I will endorse partly to the contents of Dr. Ayesha Rauf. In fact, we, the role models, have not followed the footprints of Al-Razi and Ibne Sina, and not even glimpses of those. So we have not followed the gesture of those high stalwarts. And when it goes to the students, of course, so it trickles and it minimizes the effect. So I would say the main problem is not in the youth, but among us. We, the role models, have not followed the gestures of those great people like Ibne Sina and Al-Tibri and Al-Hafiz and so forth. So they are reflections. I always say students are nothing but the reflections of parents and teachers. So we, the teachers, don't work with grace, don't keep harmony, and don't read multi-professional books, right? And don't practice it. And with our gestures, our body language, our selection of words. No, Dr. Amin used to say words have meanings. So if we have bad selection of words and our mazah, Urdu, has gone to tamaskhur. So all these things have been magnified in the students, but the main flaw is in us. We have not become Ibne Sina.
Dr. Gordon Guyatt, would you like to comment?
Well, just that was very, when I was thinking of starting this comment in response to whether earlier exposure to broader education would make a difference, and maybe it would. But then the comment about the role modeling was what really I was going to say. There's only one way to get people to behave differently, and that is the role modeling. And to the extent that, and I would agree that to the extent that things have got lost, I think the industrialized medicine is a big part of it, so that structural things in the system are a big part of it. But another part of it is that we haven't given the students the role modeling. And it was, I'm on clinical service right now, and I said, I was talking to the resident who was presenting something to me, and I said, so is the patient still married, and did the patient is visiting, did the husband come along, and so on. And the resident looks at me in a puzzled way and says, why are you asking those questions? And so it's just like they do not get it. Well, my answer was, because we're interested in our patients as people, and they are interested in our seeing them as people. Obviously, there's not too, the resident's puzzlement was that there's not too many people, not too many other people who the resident is seeing as attendings who ask those sort of questions and make that sort of point. So I think the comment about the role modeling is very crucial.
Absolutely, absolutely.
Thank you so much, Dr. Guyatt. And I think we have run out of time. It was such an intense conversation, and we all enjoyed it thoroughly. And we are thankful to all our participants and all the comments. Thank you so much, Dr. Numan Tarif. Your comments, we have got comments for Dr. Mubin, Dr. Zafar Zaidi. Thank you so very much for your comments. Just one thing, Dr. Ayesha, you have that book of Dr.
Yes.
Qadri.
If you allow me, I'll just show you this book by Dr. Qadri. It's a very compact, very nice, small book. And as Dean Parmalee says, it can be carried in a pocket close to the heart. So that perfectly describes this book. So I strongly recommend that, you ask your students and others, as well as educators, and we'll do the same, encourage them to buy this book. We'll get a complimentary copy, I'm sure. Won't we, Dr. Qadri?
You sent them, but I'm not got distributed to you. But it was sent.
No, this is my complimentary copy. So Rehma, maybe you can tell the others where they can get it from, or where they can tell.
It is available at Prince Bookstore at all its outlets in Rawalpindi and in Islamabad, and it can be delivered nationwide. There is only a very nominal price of rupees 300, and I hope all of us would encourage people to, sorry, Dr. Ayesha, would you like to add something?
I was just saying $10.
Yeah. So thank you. With this, we would like to end this session, and I'm really grateful to our moderators, to all the participants, to our international participants, everyone who has joined it. And I've learned a lot, and I hope everyone has a take-home message. So, Sir Kadri, would you like to?
I just want to say what our mentor taught us and end with Surah Asr. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. And God bless all of you for taking time, your precious time out to kind of humor me and to also talk about such important aspects of health professions education. I think there was a serious it turned out to be way more serious than I imagined, and certainly the thesis questions that you guys put together and Rehma, I was like, I don't know, I must have just shot in the dark, and I'm going to see the recording exactly what I said. So thank you for challenging me to the core, and God bless all of you, and thank you so much, and thank you for being.
Thank you so much.
Thank you, everyone.
Thank you.
Thank you. Have a nice
Assalamualaikum. Allah Hafiz.
Thank you. Allah Hafiz.
Welcome. Bye-bye.
Thank you.